Steven Faux. I'm a Professor of Rehabilitation Medicine at St Vincent's Hospital, Sydney, and at the University of New South Wales. I'm speaking to you today to encourage you to remain active, particularly if you have a disability or you're living with a disability. The reason to remain active is because it improves your overall health, in particular your heart health, your capacity to manage your blood pressure, and it also improves your psychological health, improving calmness and also decreasing sadness. Particularly during the period of lockdown for COVID, it is very important for people living with disabilities to stay active. It helps them maintain their weight, it helps them maintain the range of movements in their joints, and it allows them to keep being as mobile as possible. As well as that, it keeps you active and interested, and it engages your mind because you have to make sure you don't fall over and you negotiate things in your environment. And it also helps with mood because we know that exercise improves people's quality of life with respect to anxiety and depression. Sometimes being active, particularly when you have a disability, requires support. You need some advice from other people or even some hands-on help from people around you to get up and start being active and move around. Walking's a great idea, and if you can't walk, pushing a wheelchair or exercising your arms are all really advantageous. Don't be worried if your heart rate increases. That's sort of pretty good. That's what we're trying to do to give your heart a little bit of an exercise itself. Sometimes people with living with disabilities and people with disabilities need access to rehabilitation services. Rehabilitation services are available at most teaching hospitals and at some larger regional and rural hospitals as well. They're also available in the private sector by seeing a physiotherapist or an occupational therapist. Seeing a professional person who's used to working with people living with a disability can also help keep you active. And at the moment, we're providing services like that in metropolitan Sydney and in the country areas, either through face-to-face or even through telehealth or on your phone. Any way you can get the support is really worthwhile. Finally, if you do get COVID and you've survived quite well and you're doing all right, some people will end up having some long-term symptoms. Sometimes it's fatigue, sometimes it's shortness of breath, sometimes it's feeling a bit sad, sometimes it's being worried. And all of these symptoms can be addressed through rehabilitation services that concentrate on what we call long COVID symptoms. Probably the most important thing I'd like to say to you, everyone listening, is please get vaccinated. If you're vaccinated, your chances of going to hospital are much less. Your chance of dying is very, very much less. And we really want people to survive this, do well, and not have to be in hospital, which is really complicated for people living with disabilities. So whatever you do, get vaccinated, ask your carers to get vaccinated, and perhaps be a bit of a leader in the community that you're in and show other people that you've been vaccinated and encourage them to. I look forward to seeing you at the other end of this COVID thing, being fit and active. So good luck.